interiliac artery, anterior and posterior branches. So if you take iliolumbar, interiliac, posterior and anterior. Iliolumbar, lateral sacral, superior gluteal. You can easily remember SLIP, slip. Slip is posterior branches, the remaining are all anterior branches is what you have to basically understand. Suresh is asking a good question. How much is the highest mark today, sir? What is the highest mark? 150 आराम से मार सकते इस पेपर पे, कम से कम 120, 120 should be guaranteed. Come on, don't tell that still we are struggling at 100 line of control. You have to bubble out yourself to cross 100, cross 120, touch somewhere 130, 140. Try out where you are going wrong, and I don't think this is very unconventional paper. Very predictable questions, standard questions, and we try to pick up the questions from our nearby state MD entrance question banks of the recent entrance exams to make the paper more physiological. Of course, 20-30 critical questions we create, which even examiner will do that. Now, radiograph. What you are seeing here, medial epicondylar fracture. So, medial epicondylar fracture lead to ulnar nerve injury. Ulnar nerve injury typically is associated with atrophy of the hypothenar eminence, is what you have to basically remember. And whenever the injury is there, there is a radial deviation. Ulnar nerve injury lead to radial deviation on attempted flexion is what you have to basically appreciate. Now, what is the wrong thing about common bile duct? So, typically it is posterior to second part of duodenum, not anterior to first part of duodenum. Common bile duct, if you look at how the common bile duct travels, the retroduodenal portion of the common bile duct, it is posterior to the first part of the duodenum rather than anterior to the first part of the duodenum is what you have to appreciate. Larynx has how many cartilages? 9 cartilages. That is 3 are paid, 3 into 2, 6, and 3 unpaid cartilages is what you need to appreciate. Now, what is the phase 2 in this? Phase 2 is basically the plateau phase. So, plateau phase is because of the opening of the calcium channels is what you have to basically appreciate. Can the online students can punch whether the voice is loud and clear? I am very happy to see 72 online viewers jubilantly sharing this academic pleasure of the evening, wonderful evening. Till morning 5:30 I had been conferencing with our new company starting in Chicago. So, hosted there and operating in India. So, from then till evening 4:30 I slept and got up and came rushing. This is the baby which I already have grown up, and that is a new baby, click2clinic.com, where we are starting the home health care by MBBS doctors and a facility where doctors and patients can seamlessly interact on a app, so that video chat, audio chat, everything they can do to their consultants without visiting the clinics. So the new company we are starting up, what they don't teach in medical school is how to become an entrepreneur or a businessman. So, but unfortunately when we pass out, what we do entire life is business in addition to service, right? So that is the reason once you join MD, you plan to start a hospital, once more come back and meet me. I will tell you how to get funding, how to get marketing, how to get branding, how to get patients, and how to become popular. Yeah, these are all the areas that should be ideally be a part of our subjects in medical school. So, so it is the plateau phase where calcium channels open and typically the action potential curve. Now, if you take the lacunae have got osteocytes rather than osteoblasts. If you look at the haversian canal and the cut section of the bone is what you have to basically understand. Option D. What about option D? About osteon, yes, the surrounding nerve fibers which are passing into the bone, they pass through the in relation to the osteon. So basically contains neuron is true. Then in fact it will contain neurovascular bundle which will be passing on along the osteon. Then ABO inheritance is a dominant and a codominant inheritance, but not autosomal recessive is what you have to basically remember. Now coming to the eukaryotic gene, mRNA is monocystrionic. That is, one mRNA is for one protein production at any given time rather than multiple proteins is what you have to basically understand. Now if you look at the restriction fragment length polymorphism, RFLP, is a very important technique. Let me tell you, this DNA RNA is one funda. In biochemistry you should read. One question in biochemistry will out of 5 will be based on the DNA replication, types of RNA, transcription, translation. This entire funda will be there in 4-5 pages in Satyanarayana or any book that you study for biochemistry. But we will ignore it, resent it to review, but we need to read it because definitely one question will come. Then regarding storage protein, ricin is a phytotoxin. Ovalbumin, glutein and ferritin, myoglobin, they are all storage proteins. 50S has got 23S as a component of it. Then chymotrypsin basically cleaves phenylalanine, tyrosine, tryptophan and aromatic amino acids is what you have to basically remember. Coming to the collagen, collagen is a helix or a type 2 helix, and it has a major shape in the secondary structure is what you have to basically understand. Now coming to the leading and lagging strand in case of DNA replication, basically leading strand is synthesized continuously, lagging strand is discontinuously as Okazaki fragments and which are later being bound to one another in the DNA replication. So DNA polymerase by itself cannot initiate DNA synthesis. It requires one RNA primer. It requires a crash course program to start preparation or a mock test to get stimulated to. So that mock test is RNA primer. Is what primase is the one which produces the RNA primer. So once more doctor, if you did this questions serially wrong, take 1-2 घंटे काफी है आपके जैसे लाजवाब स्टूडेंट्स को मास्टर करने के लिए. But take it as my word, when you open up the screen of APPG, you will have a DNA based question. You will remember me on that day of in the middle of the battle zone. So that is what you need to basically remember. So synergohymenotropic toxin is basically pantene-valentine toxin, also called leucocidin. It has got two component. It is a 2-component toxin, and in this bicomponent structure, it is called as synergohymenotropic toxin is what need to be remembered. So what is meant by Ehrlich's phenomena? Ehrlich's phenomena is seen in Corynebacterium diphtheriae when you happen to add the antitoxin to neutralize the toxin. Give me the water bottle now. Yeah. Thank you. So I leave the literature for you about Ehrlich phenomena. Then false positive VDRL. It can happen with relapsing fever, malaria, SLE, leprosy, but not with Sjogren as such. Small intestine helminthiasis include Nicator, Ascaris and ankylostoma is what you have to basically remember. Malignant pustule is Bacillus anthrax. New ectodermal derivative is which one? Ciliary epithelium. Once more, how many of you did this question wrong? 100 pages wala notebook. May new ectodermal derivatives लिख के रखना, definitely they will ask doctor, no doubt on that. And one question on Brinkel arch derivatives. Once more, if you are doing the question wrong, please review that today evening only. Comeal stroma is not a derivative of new ectoderm, mesenchymal derivative, right? So, which is not a selective serotonin reuptake inhibitor. Paroxetine is not. Oh, not sorry. Except sorry. Paroxetine is selective serotonin reuptake inhibitor. SSR, fluoxetine, paroxetine, etc. Whereas methazepine, duloxetine, venlafaxine are not. And what is venlafaxine? Serotonin and noradrenaline reuptake inhibitor. It's called SNRI. Is what need to be remembered. Duloxetine is another example of a SNRI. So pure SSRI is your fluoxetine, paroxetine, etc., etc. Then what drugs lead to hyperuricemia? Diuretics, pyrocinamide, low dose salicylates. Don't forget, not high dose salicylate, low dose salicylates are the ones which will impair the excretion of the uric acid by the renal tubule and lead to development of a greater retention of the uric acid leading to hyperuricemia is what need to be remembered. Now coming to the beta-lactam antibiotics, Aztroonam is not cross-allergic. You can safely give to the people who are having allergy to the benzyl penicillin is what you have to basically understand. Now which is a prodrug? Sulindac is a prodrug. Bitoletrol is also a prodrug, is what we need to appreciate. Then regarding anti-cancer drugs, pentostatin is considered to be an inhibitor of adenosine deaminase. The other day I have told you what are cell cycle specific anti-neoplastic drugs, S phase specific, M phase specific, non-specific like alkylating agents, and the classification mechanism of action of the anti-neoplastics. 6 questions में एक क्वेश्चन आने का चांस है. So if you take pharmacology list of topics, 20 topics you have to read in pharmacology in the descending order which I gave you the list. Anybody didn't receive the list still? Hope. अरे list बोल के मैं स्पीकर ऑफ लोकसभा के जैसे बोल रहा हूँ. Please collect the high yield topic list in descending order, 60 topics in descending order in each subject. I gave you. Only read this next 30 days or 2 months में top 20 topics. Go to exam. You will do miracles. But top 10 or 20 you read, at least if 6 questions come in anatomy means 12 topics you read. Twice that of it. More than enough. Now regarding heparin. So if you take heparin, the duration of action is not that long. So it is typically after IV bolus, it also depends upon the infusion rate. If the infusion rate is 25 units per kg to 60 minutes, it is 30 minutes. If it is 100 units per kg, 60 minutes, and 150, accordingly to the infusion rate, the half-life of the heparin also will vary. Now what drug carries chance of hemolysis, just like primarquine? Even nitrofurantoin also lead to hemolysis in G6PD deficient individuals, is what need to be, we need to basically remember. Now coming to the mitochondrial DNA. Mitochondrial DNA is maternal inheritance. It is having high mutation rate, and it is generally due to the single gene mutation rather than the deletions, etc., etc. They are all the true statements. What is this pattern of immunofluorescence, doctor? You have got speckled pattern, nucleolar pattern. पहला कुछ patterns है मालूम है क्या? ANA के immunofluorescence patterns in pathology. So fundamentally what you are seeing over there is called the nucleolar pattern of immunofluorescence. So nucleolar pattern of immunofluorescence is the nature of systemic sclerosis में जो भी ANA आपको दिखाई देगा ना, that will be like that, is what need to be remembered. So you have a homogeneous or diffuse nuclear staining pattern. I will give one more slide like that in the next exam. It is typically whenever the antibodies are against the chromatin histones and double stranded DNA. Then rim or peripheral staining pattern, the antibodies are against the dsDNA. Speckled pattern, and it is the one which is seen antibodies to non-DNA nuclear constituents like Smith antigen, ribonucleoprotein SSC and SSB typically lead to speckled pattern. The nucleolar pattern is typically seen in the patients who have systemic sclerosis. So different immunofluorescence patterns of ANA is one of the favorite questions of the examiner, which you need to be quite sure about. Then doctor, dilated cardiomyopathy, where is it basically seen? Thyroid disease, viral myocarditis, and also in alcoholic heart disease, whereas amyloidosis is a restrictive cardiomyopathy. Then brain infarcts are the important feature. Whenever angioinvasive aspergillosis is there, it leads to the infarction of the brain, leading to the brain infarct. Retraction balls are seen in which injury? Typically, if you take the injury to the brain, then the axons become split and dilated. If there is a severe shaking of an elderly man, then whenever the brain injury is there, mechanical shear stress is there on the brain, then the axons will show this kind of dilatations, and the typical neuropathology is called as retraction balls is what you need to. The other day I asked you a question, no, where do you see Durex granulomas? Cerebral malaria, once more in the brain, is what you have to basically remember. Then Argemone mexicana, it contains protropin, dihydrosenguvarin and berberine, but not obain or digoxin. Then non-plant toxin is cyclohexamide, which can typically lead to the protein synthesis inhibition. Then hemodialysis is not useful in case of benzodiazepines, which are highly protein bound. If any drug is highly protein bound, it is difficult to filter it out in a hemodialysis, is what need to be remembered. How many did this question wrong? No. High mortality predisposing risk factor. Be sure in the entrance exam. Right, doctor? You are going for a professional entrance exam. People are reading cutthroat. Unfortunately, competition is so bad, so dirty. So we need to be rising and alertful to not do mistakes on some common questions like that. Scab or crust of abrasion appears brown typically between 2 to 3 days. Once more, what time, what color of the swab? Based on the color of the swab, can you guess what is the age of the swab? Is a favorite nonsense question asked in entrance exam. Then red brown color of the postmortem staining, another very standard question. So where do you see typically nitrates and aniline will lead to poisoning, lead to development of red brown postmortem staining. Where is gastric lavage contraindicated? Typically in case of kerosene poisoning, there are some important contraindication to do the gastric lavage in cases of the poisoning, is what you have to basically remember. Dr. House is asking, what about emitin, sir? Please also look into the chat window, sir. Yeah, that's right. You have any objection on emitin? I'm also not sure on emitin, about the choice emitin, but the choice which is given as an answer is definitely, I'm sure about it, it's a verified answer. So yeah, definitely I will definitely look into the chat window intermittently. Maybe other students also can proactively have a quick Google search and answer. So that is one advantage of being chat connected ecosystem. Today is a collaborative learning, it is called. No more sitting alone. In the world, if you want a company today to learn together, WhatsApp, what not app. So all the Facebook, Racebook, Foolsbook, all these things are available if you really want to use it in a collaborative way, right? So yeah, a great amount of collaborative thing is needed, doctor. Tomorrow also when you are practicing, you need to have, if you are a gynecologist, you need to have a pediatrician on board, because which baby will born preterm you don't know, right? Ultimately, until the patient is discharged, the baby's responsibility is yours. You require to be collaborating with an anesthetist. You need to collaborate with your own junior doctors, and you need to train them, keep them happy, and teach them some skills so that they will be of some help to assist you in doing deliveries. It's all collaborative. Ultimately, you need to collaborate with a local politician. You need to collaborate with a few guys in police department, few guys in legal department, so that we are more a collaborative clinical practice. If you don't have guts of doing any of these things, what will you become then? You will become a duty doctor in a corporate hospital and leave all the things to a corporate hospital, and you will be paid a little salary and you will be operating morning to evening. Right? So, but there is no money in that. There is a money when you are able to sell as a package to the world. Right? So, that's the reason preparation days only you should be collaborative. There are few things your friends will remember: better way, smart way, easy way. That's the purpose of being joyfully having an academic ride, going to the reading room. Don't read alone in a home, thinking that we need to be like a Buddha with full meditation. You should not be like Buddha. You should be like Kung Fu Panda. You must be part of a cohort to learn the art of winning entrance exam. Then you won't be depressed. So peripheral smear typically has got cystocyte. Cystocyte is a feature of microangiopathic hemolytic process. So which is typically seen in prostatic heart valve, hemolytic uremic syndrome, and TTP but not ITP is what you need to basically remember. Disc keratosis congenita, typically what is wrong about it? It is X-linked, not autosomal recessive, is what you have to basically remember. A farmer presents with a typical cavitating lesion, and the sputum is showing the presence of hyphae and fungi, which is typically the aspergillus. And how do you basically treat it? You give itraconazole, oriconazole, amphotericin B, but not ketoconazole to treat invasive infections like aspergillosis is what you need to appreciate. So what is this glomerulopathy? Is basically what variety it is called. It's called collapsing glomerulopathy. You can see the glomerular structure got collapsed. So this is a typical feature of HIV. HIV glomerulopathy is called collapsing glomerulopathy, where entire glomerular structure is being destroyed and collapsed, is what you have to basically appreciate. Then what is this histological variety that you are seeing? These are called clear cells. See, the nucleus is being pushed to a side by the abundance of the cytoplasm, which is called clear cell. Clear cell is a morphology which you see in renal cell carcinoma, is what you have to basically appreciate. Then what is this typical cell? Hairy cell. Hairy cell leukemia mein hairy cell, which is TRAP resistant or positive. Tartrate resistant acid phosphatase positive. So there you find splenomegaly, vasculitis can occur, pancytopenia can occur. They are all the features of the hairy cell leukemia. And if you happen to do the bone marrow aspiration, what is characteristic of hairy cell leukemia? Dry tap. Dry tap is what you need to basically remember. What is the one more condition where you get a dry tap? Myelofibrosis also, there is a dry tap. So aspiration will not enable you to do anything. You need to do biopsy, bone marrow biopsy. Biopsy bole to like biopsy. Aspiration is like your fine needle aspiration. Bone marrow will have two procedures. FADC counterpart is BMA, bone marrow aspiration. Biopsy's counterpart is BMB, bone marrow biopsy. You will drill and take out, no? That is biopsy. Yeah. So what is this phenotypic features suggest you where the distance between the big toe and the second toe increased, typical of the Down syndrome. So in Down syndrome there is a chance of sensorineural hearing loss, leukemia, Hirschsprung, and hypothyroidism, not hyper, is what you need to appreciate. Now if you take the gastrinoma, the most common symptom is abdominal pain is the symptom in case of the gastrinoma. So that is one part of the story.